Chair, council members, and participants, we are now live.
Councilmember Alan Dom.
Good morning, Madam Chair and colleagues, and Rachel. Or actually, good afternoon, I should say.
Afternoon, Councilmember.
Vice Chair Brian O'Neill.
Good morning. Good afternoon, everyone.
Afternoon.
Councilmember Derek Green.
I'm present here for the meeting.
Councilmember Helen Gim.
Good afternoon, Madam Chair. Good afternoon, colleagues. I am present.
Afternoon.
Councilmember Catherine Gilmore Richardson.
Good afternoon, Madam Chair, colleagues. I'm present.
Afternoon.
Councilmember Maria Quinones Sanchez.
Good afternoon. I'm present. Thank you, Madam Chair.
Afternoon.
And we are also joined by Councilmember Kenyatta Johnson, who is not a committee member, but whose bill is being heard today.
Thank you. Good afternoon and welcome, Councilmember Johnson. Thank you, Rachel. A quorum of the committee is present, and this hearing is now called to order. This is the public hearing of the Committee on Labor and Civil Service on bill numbers 210325 and 210421. Bill number 210417 is being held without being heard today. Again, that's bill number 210417. Rachel, will you please read the title of the bill?
Bill number 210325, an ordinance amending Title 22 of the Philadelphia Code entitled Public Employees Retirement Code by modifying the circumstances when certain City of Philadelphia employees are entitled to service-connected death benefits during the pandemic and making certain technical changes, all under certain terms and conditions. And bill number 210421, an ordinance amending section 17-107 of the Philadelphia Code entitled Contractors Labor Management Relationships to create a new classification of covered airport service employees to receive prevailing wages, to extend prevailing wage requirements to third-party contracts with city-related agencies, lessees and sublessees of the city, recipients of city financial assistance, and purchasers of city property, to further provide for administration and enforcement, including reporting on contractor compliance with prevailing wage requirements, and to provide for civil action to remedy violations, all under certain terms and conditions.
Thank you, Rachel. Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for questions or comments they have for witnesses. I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. I want to just ask for the record, is Councilman Heenan with us?
I do not think he has joined yet.
Okay. I wanted to give Councilmember Heenan an opportunity to make some comments on his bill number 210325. He had multiple conflicts. If he is able to join us at any time, we will make sure that the councilman is given an immediate opportunity to make comments. With that being said, Rachel, will you please call the first panel we have to testify this afternoon on bill number 210325?
Rob DuBois.
Good afternoon, Mr. DuBois. Are you connected and ready to proceed?
Good afternoon, Chair Parker. I am.
Thank you. Please state your name for the record and proceed with your testimony.
Thank you. I'm Rob DuBois, and I'm joined today by Deputy Mayor for Labor Rich Laser and Risk Manager Barry Scott. I'm here to testify on bill number 210325, and I know you have a heavy schedule of witnesses, so I won't read all the testimony which you have. Would, however, request that Council not take final action on the bill until we've had time to have our actuary project the costs of the bill. And with that, we're available for any questions you may have.
Thank you, Rob, and let me just see here. Let me open up to see the conversation. Okay, are there any questions from members of the committee for Rob DuBois relative to this bill? Hearing none. Rachel, is there another panel?
There is no one else to testify on this bill.
Okay. Thank you. Hearing none, we will now move on to bill number 210421. Before Rachel calls the first panel, okay, wait a minute. Okay, do I see Councilwoman Catherine Gilmore Richardson? Councilwoman, you have a question?
Yes, thank you so much, Madam Chair. My apologies. I was having a hard time pulling up the chat.
And I thought I was out. I thought I was done. It's like
that would have been too good to be true, Rob.
I know.
No, but I just wanted to take the time out to thank the bill sponsor, Councilmember Heenan, for his hard work on this bill, but particularly to the employees who worked on the front lines throughout the pandemic across our city and really kept everything moving when the world stopped. So I wanted to recognize them and let them know that we appreciate them for their service. For the record, I had a very quick question regarding families of police officers and firefighters that died due to COVID-19. Would they also be able to gain health care benefits because of this bill? Or if you could just put that on the record for us.
This bill, as I understand it, only relates to pension benefits.
Okay, thank you very much for the clarification.
Sure.
Thank you, Councilmember Gilmore Richardson. Just for the record, Rob, do we know how many city workers have passed away as a result of COVID?
So we know how many have been reported to us.
Okay.
So, and we've had 12 reports of 12.
Okay, reports of 12 workers. Thank you. Prayers and blessings to their family. Thank you for putting that on the record. And the chair wants to note for the record that Councilmember Heenan is now present, and I want to recognize him for comments on this legislation. Chair recognizes Councilmember Heenan.
Thank you, Madam Chair, and thank you for your due diligence and interest in this piece of legislation, and more importantly, I want to thank everybody for raising the issue about our city workforce. Just as Council Chairperson Parker has always said, it's about without our workforce, we deliver no services, especially at the quality, all right, that they expect us to do. So, so thank you for that. And this bill really exemplifies, our commitment to our workforce, our respect for them who were in employees that were out doing essential job duties, during a time where there's an international health crisis. So I want to thank all of those workers for your hard work. And unfortunately, people have passed away, just like people have passed away all across our country and in our great city, due to COVID. And we've been working with the administration for this bill, recognizing that the service death related has the opportunity to be heard and to be heard with regards to its pension. And working with the administration and recently, the pension board has made the right decision, Aaron, with the families and our employees and making a decision that had positive outcomes. So, Rob DeBoe, I want to thank you and the pension committee for, for seeing, that our valuable workforce deserves the credit and the recognition when it comes to service death related deaths that are service related for our city's workforce. So thank you for that. My intention today is to hear this bill, to have a conversation about this bill, have a conversation about our workforce, you pass it out of committee with a favorable recommendation. And my intention is to hold it on the floor of council pending ongoing and continuing conversations with the administration and our pension board. So I want to thank you all for your time. And I want to thank everybody who, on behalf of the city's employees and essential workforce who've suffered such a loss, to themselves and their families, for listening to this conversation, to listening to them, because it is for that reason we are here today. And Mr. DeBoe, thank you for, the ongoing conversation, your consideration here with trying to figure out what the actuary numbers will look like to our pension, because the pension board is in the right direction. All right, we our investments and the plans that are in place are definitely going to get us where we need to be as a fully funded pension for the city of Philadelphia. So I want to thank you all, and again let you know, long and short, I'm asking for consideration to vote this out with a favorable recommendation, with my intention to hold it to continue to work with the administration on the floor of the local. So thank you so much, Madam Chair. Thank you.
Thank you, Councilmember Heenan, and thank you, Councilmember, for clearly communicating your pathway forward as it relates to this legislation, and just noting for the record that if voted out of committee with a favorable recommendation today, you still intend on working with the administration as it relates to this issue. So we want to thank you for your leadership. With that being said, let me just again ask for the record, there are no further questions for yes, Chair recognizes Councilmember Gim.
I just had a brief comment. I also just wanted to thank Councilmember Heenan, the bill sponsor, for this. Many of us were very close to police officer Aaron Tokley, who passed away from COVID, and other city workers, and they are our team, and it's just really helpful to have this bill come forward. So thank you very much, Madam Chair, and thank you very much, Councilmember Heenan.
Thank you, Councilmember Gim, for your comments. Are there any additional questions or comments from members of the committee regarding Bill number 210325? Okay, well, hearing none, we want to ask for the record, is there anyone else here to testify on the bill whose name has not been called yet? Hearing none, we will now formally move on to bill number 210421. And before Rachel calls the first panel, I'm going to ask Council Member Kenyatta Johnson if he's interested in making any opening comments.
Yes, thank you, Madam Chair. Thank you, Madam Leader. I want to thank you for your leadership, but also just talk about asking for support for this particular bill that focuses on prevailing wage for workers who are essential workers out at the Philadelphia International Airport. We all know over this last year during this pandemic, this health crisis, we've seen a significant amount of individuals impacted as it relates to COVID-19. And this particular bill will protect and support those individuals who are on the front line that keeps our Philadelphia International Airport moving forward. And so they work day in and day out, putting their lives on the line, but most importantly, coming back home with their family members who could also be put at risk based upon the work that they're doing. And so I want to ask to vote this bill out of committee today. I am having ongoing conversations with the Pennsylvania Restaurant, and I think it's the Pennsylvania Restaurant and Lodging Association, as well as American Airlines. But I'm confident, as I have done in the past, to make sure that we can come to some type of agreement that focuses on supporting those individuals who keep our Philadelphia International Airport moving forward. And so thank you very much, Madam Chair.
Thank you, Councilmember Johnson, for your leadership. And thank you, Councilmember, for also very clearly stating your path with this legislation, and that you will continue the ongoing conversations between the workers, SCIU 32BJ, American Airlines, and PRLA, and just communicating with all stakeholders. So we thank you for that, Councilmember Johnson. With that being said, Rachel, will you please call the first panel we have to testify this afternoon on bill number 210421?
Rich Laser.
Thank you, Mr. Laser. Are you connected and ready to proceed?
Yes, Councilperson.
Thank you, Mr. Laser. Please state your name for the record and proceed with your testimony.
Thank you. Good afternoon, Chair Parker and members of the committee. My name is Rich Laser. I'm Deputy Mayor for Labor for the City of Philadelphia, and I appear before you testify in support of bill number 210421. This bill amends Chapter 17-107 of the Philadelphia Code to establish a new category of city work covered by prevailing wage. The bill identifies how the prevailing wage are to be derived and which employees are to be covered. It also provides for certain reporting requirements, enforcement provisions, and the right for civil action in the event of a violation. I'd like to thank Councilperson Johnson for introducing this bill and his leadership on this issue, which the administration supports. The administration is prepared to enforce this, and I look forward to any questions that you may have.
Thank you, Mr. Laser, for your testimony. Are there any comments and or questions for Mr. Laser? And Councilmember Gim, no, I think that was the previous bill. Okay, hearing none. Now, Mr. Laser, I know I'm shocked today too, that I don't see, any colleagues with any questions, but we want to thank you so very much. So if there are no more questions or comments, is the next panel here?
Yes. The next panel is Gabe Morgan, Danielle Hall, Aisha Casilla, who I believe is waiting in the lobby to be let in, Roslyn Wuchenich, Nathaniel Sokin, and Charles Patton. And I'm sorry if I mispronounced any of those names.
Thank you. Gabe, can you please state your name for the record and proceed with your testimony?
Yes, thank you, Councilwoman Parker. My name is Gabe Morgan. I'm the Vice President of SCA 32BJ, which represents thousands and thousands of service sector and property service workers in Philadelphia. I'm here to speak on behalf of our 2,000 members at the Philadelphia Airport, who are folks who are wheelchair attendants, baggage handlers, line queue security workers, sky caps, folks who have been working in the airport for years and years and years, who worked there for poverty wages until the last time council intervened, and who have now worked through a pandemic without any health care, working for employers who are contracted by airlines who receive billions and billions of dollars in federal taxpayer money over the past year. We believe that the prevailing wage law that exists in Philadelphia has really done a good job in setting standards for workers of all kinds across the city. And expanding that law to cover these sorts of workers, we think will make sure that workers at PHL finally have health insurance, finally have enough paid sick time, finally have paid days off, finally can make $15 an hour or more overtime, and are tied to the standards that the council has set all across the market at Philadelphia. Our members have worked throughout this period in really, really difficult conditions, risking their lives as essential workers, without the things that essential workers should have: health care, any real paid sick time, a living wage, and an industry where you're under a lot of pressure interacting with all sorts of folks. So we urge council, and I'll keep my testimony brief and I'm happy to answer any questions, but we urge council to pass this through committee without amendment today. We appreciate the enormous support that there's been from council on this bill and from the administration, and really the long support there now has been from council and from this administration on supporting these sorts of workers. Because what we know is, left to the industry, left to the airlines, left to the contractors, these workers would never get health care. They would not make $12 or $13 an hour now. They would make $5 to $8 an hour, which is what they made before the last time you acted. We know that if this legislation does not move through, that's an industry that, despite getting all of the billions and billions of public dollars that it's gotten, will never extend those sorts of benefits, to these sorts of workers. And we know that because they've had every opportunity to do so and can do so at any time, and have never chosen to do it without council acting. PHL is an asset of the city. It's an economic engine. And this is an opportunity to ensure that there are thousands of good jobs for folks in Philadelphia at a time when the city could really use more of that, and in a way that really does not cost the city of Philadelphia any significant money. So we think it's a very good thing for the workers who deserve it, who fought for it. But we also think it's a very good thing for the city more broadly and for the economy of the city. Thank you very much.
Thank you, Mr. Morgan, for your testimony. Danielle Hall, are you connected and ready to proceed?
Yes, I am.
Thank you, Danielle. Please state your name for the record and proceed with your testimony.
My name is Danielle Hall. I work for Prospect as a lead. Right now, that just entails like assigning the flights and making sure that everything is copacetic for the company as far as like the flights and everything. Now, with my job, I am working with the COVID passengers, but it's not a whole lot of social distancing due to the testing site being above me. And with the passenger, you're moving them, so they're coughing, they're sneezing, that's going right back into your face. So you're not protected on that note. Now, I was laid off for 3 months with the pandemic. So during that pandemic, I did not have health insurance because I was getting it through the job. Now that I'm back at work, it's a pre-exposure now because I also have a young daughter and a diabetic mother. So this raised me a whole lot for me as far as like getting to do stuff for my daughter and spending that quality time. Thank you, guys.
Thank you so very much, Danielle, for sharing your testimony. Aisha, were you able to get connected, Aisha, and get in the room? Did someone let Aisha in? Okay, while our technical staff is working on admitting Aisha into the room, Rosalind, are you connected?
Yes, I'm here. Okay.
Thank you, Rosalind. Let me note for the record, when Councilman Johnson made his opening remarks, he talked about working with the stakeholders. We mentioned SEIU 32BJ, and we also want to acknowledge Unite Here. And Rosalind, thank you for being here. Please state your name for the record and proceed with your testimony.
Okay, thank you, Councilwoman Parker and members of the committee. My name is Rosalind Wojcicki. I am the president of Unite Here, Local 274, the hotel and food service workers local here in Philadelphia. Here today to testify in support of bill number 210421. And we are extremely thankful to Councilmember Johnson and each of the council members who have sponsored this proposed legislation.
Rosalind, can you hear me?
I will say that I'm down here. Yes.
Aisha, it seems like you are connected right now. Aisha,
yes.
I'm just going to ask you if you can go on mute if you
I can hear you, yes.
Okay, so Aisha, go on mute for me. Thank you so much, Rosalind. I apologize. There was interference. Would you mind going back about 5 sentences?
No problem. Good afternoon, Parker. Thank you, members of the committee. My name is Rosalind Wojcicki. I'm the president of Unite Here, Local 274, the food service worker and hotel workers union here in Philadelphia. And I'm here today to testify in support of bill number 210421. We are extremely thankful to Councilmember Johnson and each of the council members who co-sponsored this legislation. I will say I am down here at LSG Sky Chefs with our LSG Sky Chefs members who are watching the hearing online on their breaks and as they're coming off work. And if you hear the planes or the trucks in the background, that's where we are. As Gabe mentioned, City Council has taken tremendously important actions over the last 7 years to transform the lives of those who work at the Philadelphia International Airport. When we first began organizing the concessions workers at PHL, many people were only earning $8 to $9 an hour. Today, the minimum wage, as you know, is $13.75. It will be at $15 by next summer. In unionized workplaces, workers have been able to negotiate higher wages over and above the minimum wage, as well as key protections regarding their hours and schedules, their ability to keep their jobs, and their right to be respected by their employers. Time and again, over the past decade, City Council has taken leadership and recognized how important the project of improving work at the airport is to the health and well-being of our city as a whole. We are tremendously grateful to the council for that recognition. The proposed amendments to the prevailing wage law that we're discussing today would further improve the lives of airport workers in an area where we have not been able to make major progress, which is the right to quality and affordable health care. At PHL, we have made significant progress in organizing and raising wages. However, for the vast majority of PHL food service workers, access to quality, affordable health care remains out of reach. This legislation can change that. High deductibles in the plans that are offered by company healthcare plans mean that when a worker who pays every single week for their health insurance out of their paycheck then actually goes to the doctor or goes to the hospital, they might pay thousands of dollars out of pocket before their co-insurance actually kicks in. That's what those deductibles mean for our folks that work at the airport. Even once the co-insurance kicks in, many plans only cover a percentage of hospital or other costs, which this leaves many workers that make less than $30,000 a year annually with medical bills of thousands and thousands of dollars. And that is not real health coverage. Employers also never agree to pay the full cost of the plans. which leaves workers paying as much as $100 per week out of their paychecks. As a result, the majority of the workers do not have employer-sponsored medical coverage. Workers either have no health insurance at all, or they're using taxpayer-subsidized forms of health coverage that we as taxpayers, the government is paying for, despite working a full-time job, or they're lucky enough to have insurance through another family member. All of this means that many workers, with or without health coverage at PHL, don't go to the doctor or the hospital when they should. And it means that the fear of getting COVID for many airport workers was heightened because a trip to the hospital could be financially devastating, even if they survived the virus. It also means that so many chronic diseases, which could have been prevented or managed, can result in catastrophic outcomes because of lack of access to real health. So as a union, we work hard to raise the principles of the Black Lives Matter movement. For us, part of fighting for the lives of our Black and brown members means fighting for real health care for every worker. Currently, because workers of color remain overly represented in lower paid, non-tipped positions, it is largely tipped workers who are more likely to be white, who can afford to pay for the company health care. While we struggle to alter these racial disparities in our workplaces, we must also make sure that every worker, regardless of classification or race, has real health care. This bill will make that a reality. It will require a minimum payment toward health benefits. The current minimum payment that this bill would require would be enough to pay for a union health plan with no deductible and no or very limited co-insurance for full-time airport workers. That would change airport workers' lives. So we again thank Council for all it has done in this journey to transform work at the Philadelphia International Airport, and we urge you to pass this bill. Thank you.
Thank you so very much, Rosalind, for your testimony. We're now going to go back to Aisha. We see you now, Aisha, and I hope I don't chop up your name. I was going to say Aisha Kasia. If I did, Aisha, charge it to my head and not my heart. But state your name for the record and proceed with your testimony.
Okay, my name is Aisha Kozair. I live in Shadow Hill, Delaware County, and I've been PSA at Philadelphia International Airport at the last 6 years. I make $13.60 an hour, and I do not have employee health plan. I have health partner for my insurance because I'm current have cancer survivor and sickle cell anemia. Come back to work after layoff for 7 months during pandemic. It was literally exposed to COVID-19. I cannot social distance for passenger in my wheelchair, and so I take care of my 2-year daughter and myself. I have worry about her health and mine too every day at work, and I need free health care and in the 15 hours budget to be able to take care of my daughter and myself. And very soon my daughter will just turn 5, and soon I will need to figure out how to pay someone to get back for school. I was and work in $15 for budget. When mean that be able to pay for her care when I work and at the hospital getting treatment. COVID-19 is not
Okay. Daniel, please state your name for the record and then proceed with your testimony, please.
Thank you, distinguished members of the council. My name is Nathaniel Sokan. I am from Liberia, West Africa. I arrived in the United States on March 24, 2014. I had affordable health care service insurance in my country. To my surprise, when I came to America, this was not the case. I went to LAG Scout Sheriff. I have been there for the past 7 years. We are the workers who cater to the airline. The health care at my job is super expensive. I cannot afford it like many other workers, many other employees who also cannot afford the coverage. I struggle with the coverage because I have health conditions. Sometimes I go a month without paying my rent and other bills because of the high cost of the health coverage. I have to meet up with this at the end of every month. Last year, I paid over $400 a month for my wife and myself coverage. We have to do something about this. Honorable members of the council, a lot of my colleagues do not have any health insurance because they cannot afford the cost. We had to make sure flight take off with well-prepared food. We are kindly appealing to you to pass this bill, which is in the best interest of our workers. We need this because some of us have health issues we cannot handle because we cannot afford the cost. Once again, I struggle with this because I need to be here. I support 7 children and my wife. It is very hard. I therefore pray that this bill be passed by the City Council to protect our health. We deserve this. I wish you a successful deliberation. Thank you.
Thank you, Nathaniel, for your testimony. We appreciate your being here. The chair now recognizes Charles Patton. Charles, are you connected?
Yes, Madam Chair, I'm here.
Okay, thank you, Charles. Please state your name for the record and proceed with your testimony.
Yes, hello, my name is Charles Patton. I'm a cook at the Philadelphia International Airport at Bar Simon. I've worked for PCE at the airport for about 8 years. PCE is a food service company that has multiple concession stands at the airport. I've worked in food service for 21 years. Some of the other places I've worked include Chick-fil-A at the airport and Boston Market for around 13 years. Being in the industry for so long, I can confidently say that we need better healthcare. When I was at Boston Market, I had healthcare, but it wasn't good. During that time, I had an outpatient surgery, and my healthcare coverage left me with a bill of over $2,000. On top of that, my premium was already high. My bills were piling up, and I needed a second job. I got hired at Chick-fil-A, my very first airport job in 2007. To my surprise, the company didn't offer any insurance at that location. My mother's health started to decline in 2009, and even more bills and stress began to add up. I left Boston Market and picked up a second job, which was PCE at the airport. At that time, PCE did have insurance, but I couldn't afford it. The premium was too high. The deductible was $5,000. There was no way in the world that I was going to be able to afford that. Now, because of the union, I have better options for healthcare. I currently have coverage with PCE, but it could still be better. I've spent over 20 years looking for decent coverage at work. To be honest, my coworkers and I at the airport deserve free healthcare. We faced and continue to face all kinds of safety issues due to the pandemic. Some of my coworkers have gotten COVID-19, and our health matters. If I was receiving free medical care, I could save more money. I wouldn't experience so much financial burden. I could have coworkers. I have coworkers who have to decide to either pay for medical care or their rent. People should not have to choose between taking care of their bills, feeding their families, and receiving medical care. Healthcare is usually left out because of these other needs. Once again, I believe that nobody should have to make this decision between these basic human necessities. But at the airport, these decisions are being made every day. So please, City Council, pass this bill for workers at the airport. So workers at the airport don't have to choose between basic human necessities. We deserve affordable health care. Thank you.
Thank you so very much, Charles, Nathaniel, Aisha, and Danielle, for your testimony, and to our labor leaders, Gabe Morgan and Roslyn. Thank you both so very much for being here as well. And Charles, I would, agree with you. That's not a choice that folks should have to make, whether or not they can afford to go to the doctor and or pay their rent or go buy groceries. So thank you for being here. And the chair recognizes Councilmember Johnson for questioning and comments.
Thank you, Madam Chair. I just want to thank the workers who really took time out of their schedule to step up to the plate and really have the courage to tell their story. It's one thing for we as elected officials to advocate. It's another thing for our union leaders to advocate, but the workers who are on the front line day in and day out, whose families are impacted, who are putting their lives on the front line during this pandemic, really sends a heartfelt message as to why this bill is so much needed, but most importantly, why we advocate for those who need a voice, right? Why we advocate for those who need a voice. The airline industries, they have lobbyists, right? We're here to fight for you. And so we just want to thank you for taking time out of your schedule. Thank you for being here. Thank you for Roslyn, and thank you for Gabe for always speaking truth to power. Because at the end of the day, it's about making sure those who need a voice have someone to advocate and fight on their behalf. And so when we fight, we win. Thank you very much. Take care.
Thank you again, Councilmember Johnson, for your comments and for your leadership here. Chair recognizes Councilmember Dom.
Thank you, Madam Chair. And I want to thank Councilmember Johnson for this legislation and also his willingness to work through the concerns I know that the Pennsylvania Restaurant Lodging Association has raised. I really appreciate that. And I know they're looking forward to working with you, Councilman Johnson, so thank you for that. I do have a question for Shelley is here from the airport. I wanted to ask her a question if she is available. There she is.
Yes, I'm here.
Good afternoon. So I guess my question is, I know the airport's had a really, really tough year, okay, staying afloat with what's been going on during the pandemic. And I know that tourism is starting to come back, but I also don't think business travel is going to come back soon. It doesn't appear to be coming back soon. I hope it does, but it doesn't appear that way. So understanding those issues, I'm just curious about the financial impact of the airport overall. And what do you anticipate this will do to your direct labor costs? How does this current labor negotiations play into the impact of the bill and that of your concessions or contractors? And just kind of an overview of how this will play out.
Thank you, Councilmember Dom, for the question. Good afternoon, members of the committee. Shelley Cameron. I'm the CEO of the city's Division of Aviation. So you asked about our financial impact. The previous fiscal year, current fiscal year, and next fiscal year, our revenue losses are estimated to be about $500 million. We did receive federal relief money in the amount of about $260 million, but that really is just a little bit more than half of what our losses actually are. And so we have had to make very difficult decisions ourselves about what we needed to do to make sure that the airport was able to continue to operate. You referred to business travel coming back, and I think that speaks to how air travel is very different today than what it was before. This is very much a leisure-driven market right now. The majority of our passengers are leisure travelers, only about 10% business travelers. And what that means is that those are folks who are looking for the low price, the low cost airfares. They are less likely to spend money at the concessions and other airport businesses. And so it really presents a revenue challenge. We are still in looking at June, which is the only month I really feel confident in giving you a projection for. The airlines are making decisions really very quickly in how they deploy their resources and what flights we have and what we don't. And in looking at June of this year, we are still down more than 30% when compared to 2019 in terms of the number of seats that are offered out of the airport. And so I think the best way to say it is that we are recovering, but we are not recovered. I also want to note that we believe that it is incredibly important that all workers at the airport are paid a fair wage and have access to health care. We are concerned about what the impact may be as we move forward. Ultimately, when we looked at the concession program alone, in the first year, we believe the impact could be upwards of $8 million. And that is an amount, that's just the concession program, and that's an amount that could continue to increase as we go along. That money and to pay for this would have to come from really one of three places, probably a combination of those. The concession operators would have to take a look at their margins and make less in terms of a profit. Many of our concession operators are local, small, minority and women-owned businesses, and so that's something that they will have to take a look at. It could hit the airport bottom line, and I talked about that when I started my comments, that our bottom line has already been impacted significantly, but that's another place. And a third option would be that the cost of what travelers pay in terms of when they buy food and retail goods could go up. So for our concession program alone, looking at the loss or the increased costs and where that would come from, there are three options, but there are issues with all of them.
Okay, thank you. I just wanted to try to understand that. Thank you very much. Thank you, Madam Chair.
Thank you, Council Member Dom. I have both Council Members Helen Gim and Kenyatta Johnson in queue. Before I call Council Member Gim, I want to ask Gabe Morgan if you could just provide for us, Gabe, a response to what you just heard coming from Ms. Cameron relative to the airport, particularly when she talked about the concessions, looking at their margins and the impact that this could potentially have on the industry.
Sure, I can speak some to the concessions, a little bit more specific to the airlines, but I would just say in broad strokes, just so folks watching this or council people understand, the legislation that's in front of council has already been enacted by the competing airports of PHL at higher rates than what we're suggesting would happen here. All of the New Jersey and New York airports, the competing northeastern hubs, have already passed similar legislation that has higher wage rates for concessions and contracted airline workers, and higher healthcare costs and higher everything than what's proposed here. So PHL in doing this is not paving the way in doing something that's happening for workers in the industry. It's really coming into compliance with what other states who are in competing airports have already done at higher rates to lift their residents out of poverty. Anytime, including now, when the government or some other entity, a union or et cetera, seeks to step in and make sure that workers actually have something like health care or a living wage or paid days off, it's true, there's a cost. I would suggest to council that the cost of not providing those things to the city is much higher than whatever the cost would be to a particular concessions vendor or et cetera. And frankly, from an airline perspective, PHL is considerably more profitable for American Airlines than LaGuardia, Newark, or JFK are for competing airlines. Every global airline or national airline needs a Northeast hub. This is the one that American Airlines can be in. It again turns more money for them. That's a function of profit than any of the competing airports. And yes, it's true. The entire airline industry and the whole industry took a huge hit with COVID, and it will be a while till it comes back. And that's why the federal government gave them $10 billion to try and help them get through this period. And the idea in the federal government and why that was possible for them to get that sort of publicly subsidized bailout from taxpayers was because they committed to try and help protect people's jobs, create new jobs, make sure that people have health care, do all the right things. So really what we're asking council to do here is exactly in line with the spirit of what the federal government was doing when it gave the airlines and the industry the billions and billions and billions of dollars in bailout money that they just recently got. So I don't believe we're asking you guys to do anything else either out of line with what the rest of the market is doing. Anything that the industry can't afford. After all, it's being heavily publicly subsidized. And we think it is the right thing to do for the Philadelphia local economy by helping workers have more purchasing power and health care and et cetera in the city. Thank you.
Thank you, Gabe, for your response. The chair is now going to recognize Councilmember Gim, and after Councilmember Gim's questioning, we're going to turn back to the sponsor of this legislation, Councilmember Johnson.
Thank you so much, Madam Chair, and I appreciate your question because I think it's similar to what I was going to ask. I have been out at the airport on numerous occasions, as have all of our council colleagues. Marching with workers who are there who have struggled to pay their health care, who struggled to, get basic benefits, whose wages are lagging. And I guess I wanted to just, express a lot of gratitude to the workers who are on here, but also invite Rosalind, if she's still on and able to connect, Charles and others, just to speak a little bit more about particularly the benefits issue, which is one of the important issues that I think this particular bill and the importance of it start to address. And if Rosalind's available to connect, that would be wonderful.
Rosalind, are you still connected?
Yes, I am. I'm here.
Okay, thank you, Rosalind. Please respond to Councilmember Gim.
Yeah, on the benefits issue, I think our members that spoke said it very well, and there is a real crisis around healthcare at the airport, and when we say that everybody should deserve your access to healthcare, the way that you do that with workers who are earning in this hourly range has to be by the employers do need to pay more for healthcare. When people are asked to pay large amounts out of their paycheck every week for their healthcare, and for very bad plans, as I described in my testimony, people do not elect the healthcare, and they don't have healthcare, and that has very serious outcomes for our city, and also for us as for city government in terms of what we end up paying for, because the number of our members that are going into emergency rooms for things that could have been prevented, that could have been dealt with in a doctor's office, that could have been dealt with at urgent care, but nobody is going to those places because they don't have insurance. It's unbelievable. And so this is a real crisis, and something that, as Gabe said, there is a cost to it. We think that is a justified cost. And I will say that in terms of cost and priorities, we know that, not only Gabe described the federal money that has gone to the airlines and to airports. In addition, the city of Philadelphia has been giving very substantial direct subsidies to the concessions program over this last year during the pandemic. The way that the concessions program works at the airport is the concessionaires pay rent to Marketplace, and Marketplace pays to the city of Philadelphia. And there's a lease in place. What has happened during the pandemic is that, and the way those leases are structured is there is a minimum annual guarantee they refer to in the airport world as MAG, a minimum amount that has to be paid by every airport concessionaire. And there's a percentage of revenue that has to go. So obviously, when you have no revenue, there isn't really anything you have to pay to Marketplace or to the city, but that minimum annual guarantee has to be paid. That was waived during the pandemic, and it was waived without any requirements regarding paying people on layoff or making sure people had health care during a pandemic, particularly the people that were working and risking their lives during this pandemic while working at the airport. There were absolutely no requirements or protections for workers connected to that rent relief. And it was a massive, massive relief. And the new Marketplace lease, which is currently being negotiated and will be brought before council, which would go into effect next year, that lease also is being revised because of the pandemic to help the concessionaires with these issues. So, if we as a city and as taxpayers are going to support these concessionaires, I think it should be done making sure that those people that are working in those jobs both have decent wages and have real health care, which is what this bill would do. I would also say that while of course, the prices at the airport are high for most of us. We know that in the past, prices, the city, when the 21st century minimum wage went into effect, there were incentives provided to some employers to comply quickly with that, to allow street pricing plus 10%. There are things that can be done which, as a union, we would support in order to make sure that the people that are doing that work to provide the food and beverages and everything that to make the airport successful are not working without health insurance.
Thank you so much. And Rosalind, just, I know that there was mention of some of the small businesses, and I think you point out to the fact that the city of Philadelphia does try to subsidize, but many of your workers work for one of the largest businesses. Is that right?
Yes, I should say.
I was wondering if you could just give us just a very short, we can keep it brief, but a very short rundown of a little bit about the larger businesses that should really, this bill should designate and set a standard for any publicly owned airport, a living wage, and if at least a prevailing wage standard.
Sure. Yes. No. The most of the employers at the airport and the large employers at the airport are large national and even multinational food service corporations. For example, HMS Host, Hudson News, Compass Group, Sodexo, OTG, Arias, Parodies. All of these are national or multinational corporations. These are the companies that employ the majority of the workers at the airport. And I will say that some of the smaller employers, in fact, that are unionized, are already offering union health plans. Now, still, we don't have the people electing those health plans because of how much they have to pay out of pocket, but they have shown a willingness to offer a truly quality health care, and that's even small employers. So we believe this is doable, and we also believe that it's necessary.
Yeah. Thank you very much, Madam Chair, and I appreciate the responses from both Gabe Morgan and Rosalind. Thank you.
Thank you so very much. The chair recognizes Councilmember Johnson.
Yes, thank you, Madam Chair. Just have a question for Shelley Cameron from the airport.
Yes,
Hey, Shelley, how are you today?
I'm fine, Councilmember Johnson. How are you?
I'm doing pretty good, can't complain. Just wanted to follow up regarding the rent relief initiative that was just discussed for the airport concessionaires, and I'm under the impression as well that another bill that will be coming to council that will further support those concessionaires, which I think is good during this pandemic. But can you put a dollar amount on how much have been, I guess, provided in terms of rent relief from the last year pandemic, plus what's going to be coming in front of council moving forward, and how long will this next bill extend the rent relief to? Just for the record.
Sure. So I don't have the exact number in front of me. I don't know if Jim Tyrell is on and can provide the exact amount of concession relief. I will just offer a couple comments. One is that the existing rent relief program goes through June, and we had anticipated extending it. So it will be going on further. We were talking about potentially through the end of the year, but we had tied it to business coming back. So in other words, if business comes back and the concessions have an opportunity to actually make sales, then the rent would come back at the levels it was prior to the pandemic. Second,
and yes, go ahead.
Just one other point. Some of our federal relief money is contingent on us giving relief to our concessions. And so we in order to get that federal relief money, some of the $260 million that I talked about earlier, we have to give the relief to the concession operators. And just one other thing, and Jim, I think is here. Many of our concession locations were closed for extended periods of time. They weren't even open during the pandemic. And right now we have a little over 50% that are open. And that's just because the business isn't here. We don't have the people coming through and they're not purchasing things. So, Jim, if you're on, if you could maybe give that figure.
Sure. So the value, Councilmember Johnson, of the weighting of the MAGs is approximately $27 million. So annually, our concessionaires guarantee revenue to the airport in the amount of $27 million. And since the majority of them weren't open for a period of time and half of them are still not open, there was really no way we could require them to pay that money to the airport. So essentially, we waived it, and now the concessionaires who are open pay us a percentage of gross sales.
But essentially, it's $27 million in relief, correct?
Correct.
Okay, just wanted to clarify that for the record. All right, thank you very much.
Thank you, Councilmember Johnson. I am looking in the chat box now, and if there are any other members seeking to make comments or who have any questions, please raise your hand or put it in the chat. And in the meantime, I want to ask, Councilmember Catherine Gilmore Richardson has a comment.
Thank you. Thank you so much, Madam Chair. And I just wanted to come on the record to thank our colleague, Councilmember Kenyatta Johnson, for his work on this legislation, for all of those who testified, particularly the workers at the airport. We're deeply connected to the workers at the airport and actually have a very close family member that works there. So I just wanted to thank you all so much for your service throughout the entire pandemic and the service that you continue to provide. I also wanted to give kudos to Councilmember Johnson for his willingness to work through some of the challenges we heard around the minority vendors at the airport. So thank you so much, Madam Chair, and thank you to all of those who provided testimony for this hearing.
Thank you, Council Member Gilmore Richardson. And Council Member Gilmore Richardson, you raised another issue, and I'm going to ask both Gabe Morgan and Rosalind to respond to this. You know, during the midst of this pandemic, members of council, you know, I don't care if we were with hospital workers, you know, in front of Temple University. I don't care if we were, you know, in town or on routes with the Philadelphia sanitation workers. We found that lots of people were saying that they respected and appreciated the work of essential workers, frontline workers in the midst of this pandemic. And some were quick to put statements on their websites, you know, to say, yeah, you know, we support our workers. But oftentimes there was a fight to ensure that those words translated into additional pay or health care coverage. Rosalind and Gabe, do you all have any data relative to your membership and those who may have been impacted by COVID during the midst of this pandemic that you want to get on the record for us?
So, Councilman Parker or Roz, I don't know if you want to go first, or I can go first, whatever you'd like to do, Roz.
You can go ahead. I can speak after you.
Okay, thanks, Roz. So I think I can give broad strokes data, but I think I'd like to just convey the experience to council of one of our members, and I would like council to know that we have hundreds of members at PHL watching this hearing on Zoom right now. And so, like all essential workers, and I think Councilman Parker, you really did a good job describing the experience. They've worked through this period where everyone is calling them a hero, but no one wants to give them any of the things they need to protect their family. So when this began, initially, if I'm a plane cleaner, I'm already working in an industry where my employer says things to me like, if you leave work tonight, even though we didn't tell you we're going to extend your hours, we're going to write you up tomorrow, and if you don't like it, you can file a grievance. If you don't leave, you lose your job. If you stay, no one picks up your kid. So that's before the pandemic. Then you start working at the airport where the schedules are terrible. You're going in to clean up planes. They're not providing you with the PPE that you need to be safe. Travels obviously dropped significantly, but there are still people traveling. And so imagine you're working through that with everything that everyone is seeing, riding separate to get there, cleaning planes. No one tells you how your schedule is or when it is. You're risking COVID. And then let's say you find out, as we've had happen many times, that a coworker has had to quarantine because they have COVID. No one then tells you whether you should quarantine or not, and the way they should for months. Once they do tell you, when you quarantine, you don't have enough pay to protect your family. God forbid you actually do get sick. You don't have any health insurance. And we've had, and then you have to choose, do you come back to this job and risk it all? Or, you know, what do you do? And so we've had dozens of members in that exact experience at the Philadelphia airport, particularly plane cleaners, not just plane cleaners, but particularly plane cleaners. And you can imagine from the function of their job, who've had to quarantine, who have been in situations where they have no idea whether they're safe or not, who don't have access to health care, and really haven't had a lifeline throughout this entire process. And we've had help, and that help has really come much more from the city itself, again, where the city started working with other organizations to try and create testing centers at the airport. I know Unite Here and SEAU and other groups, and I think Unite Here really took a big lead in this too, tried to create testing for our members. You know, we've tried to do everything we can to support people through this. But the reality of being an essential worker with no health care during COVID just means you are permanently at risk in what was already a poverty wage job. And you're essential mostly because you're in some sort of high risk situation, whether that's being a plane cleaner or a janitor or a security officer or, you know, a SEPTA worker. So there are a number of statistics on the higher rates that essential workers have gotten of COVID at. I've seen things from 33 to 70%. That's the regular population. I think that's what we see with our members. So, Councilman, I hope that helps answer your question. Sorry,
that was Rosalind. You have anything you'd like to get on the record?
Yeah, I think I would just add that for the folks that have continued to work at the airport during this pandemic, and we've had people working throughout the pandemic, even though many people were laid off, the people that continued to work through the pandemic were putting themselves at major risk. We did have multiple outbreaks of COVID at the airport amongst our membership, and it was extremely dangerous. And we had as you said, folks needed to keep things running, but didn't have the protection that they needed. And some of that, social distancing is just not even possible. And some of the kitchens at the airport, these are very, very small spaces where food is being cooked at the airport. It was not possible to distance. And then, indoor, for our members who are serving people, the folks working at the terminals, they are serving people food. So, obviously when indoor dining has been allowed, I think we all know that indoor dining is, the most dangerous thing, because obviously you can't eat with a mask on. And that's the main way to prevent COVID. So our folks were being, as part of their job, exposed to COVID on a regular basis. And even when indoor dining was banned, the reality at the airport was that you were taking out food and taking it to a gate where people ate. And so there was really... our folks were being exposed very regularly, and doing that, many of them, as we've talked about, without any health insurance. And I will say that, unfortunately, we had a number of employers, including the biggest employer at the airport, that cut off people's insurance the day that they were laid off, and did not reinstate it the day that they came back. And so there was no buffer whatsoever for folks. So that's been our experience, and there have been a significant number of cases at the airport because of all of that.
Thank you so very much, Gabe and Rosalind, for getting those specifics on the record relative to your membership and COVID's impact on those working men and women. Let me also, again, just commend our colleague, Councilmember Kenyatta Johnson, the sponsor of this legislation, for also making a commitment to, reach some much needed compromise and work with the airline industry, talking with Shelley Cameron, along with the PRLA. I appreciate that leadership, Councilmember Johnson, and your acknowledging that you will continue working with all parties as we move forward after we take action today on this legislation in committee. With that in mind, the chair recognizes Councilmember Green for questions.
Thank you, Madam Chair. I also want to echo the sentiments that you just delivered regarding Councilmember Johnson for taking leadership to work with all parties to address this issue, which is very critical for employees at the airport, not of the airport, but working at the airport, who are, as you stated, frontline and essential workers who have in many ways risks their health in order to maintain employment, but have had a challenge in reference to health care. I guess a question I have for Mr. Morgan and Ms. Vucinich, we talked about exposure to COVID for the members. I'm curious in reference to vaccinations and what steps are occurring by those employers or others to try to provide opportunities for your members at the airport to get vaccinated, and additional efforts that need to occur.
So for 32BJ, I'd say our experience so far with vaccination employers has been similar to all of the other experiences with them. They're not, I don't think that we can depend on the employers or the airlines, for that matter, to try and look out for the welfare of our members. Has been our experience. We have been trying to do the best we can to educate our members about the vaccination, encourage them to get vaccinated, and to have any questions or concerns they have, talk with a doctor. That's a harder conversation when you're talking to somebody who doesn't have health insurance, but that's what we've done. And then we've tried to do the best that we can to share with them whatever publicly available information there is on how people can get vaccinated. The vast majority of these workers are African American workers. I think we've seen in the positive news an uptake in the level of folks who are willing to be vaccinated as education has grown, and we hope that'll continue. But I think we started this thing in a very bad place, and hopefully we'll get to a better one. But really, with all of your help.
Yeah, I would. It's been very. I have to say, we really didn't even. We have not been relying on the employers on the vaccination front. Very similar to what Gabe has said. We, as a union, worked very hard to get access. Our members were eligible early, which we're very appreciative of, in terms of what the Department of Public Health, where they were. The City Department of Public Health recognized that food service workers should be high up on the list for vaccinations, and we appreciated that. It was hard to find places for people to get the vaccine at first, and we were able to partner with some community health organizations, and really we pushed very, very hard with our membership, both to get people that were ready to get the vaccine into appointments, and then also doing information sessions with healthcare professionals, and those were led entirely by Black healthcare professionals, with our membership to help people, have a place where people could ask their questions. And we have, as Gabe said, we've seen a real shift in people that were hesitant at first, who have been, have gotten the vaccine now. There's still a lot of work to do. I do think that if the employers were pushing it harder, that we would see more people getting the vaccine, but that hasn't been our experience. I have not seen the employers pushing vaccination in the way that I've seen our union and other unions like the HBJ.
And to follow up on your last point in reference to pushing harder, now that we're getting to a point of more and more vaccinations, have you seen from any of the employers making any type of requirements or other type of mandates regarding positive, negative tests for COVID or requirements of vaccinations in reference to ongoing employment or anything in that regard?
I mean, our experience has been the employers have essentially followed what the CDC guidelines are if we scream and holler enough about following the CDC guidelines, right? I do think, and I'm concerned that we're heading towards a period where employers are going to increasingly say, you must be vaccinated to work here, without putting in the education effort or energy to actually educate people about the vaccine. And then, in this case, saying that to a workforce where you're currently not providing health care is, we think pretty terrible. But look, the history of this industry, contract services and concession workers at airports has historically been terrible. It was to get folks to the 21st century wage, to a bare standard that did not give people health care. Remember, all it took was 4 strikes, a new mayor, 4 new city council people, changing the city charter, and then you guys imposing that change on the airlines, even though back then the airline said, if you make us pay these workers a living wage, we'll pull out of PHL and move to fill in the blank, right? Now where we are again is we're going through a pandemic. These workers didn't get health care. Ross and I have had to sit with our members, hear those experiences, be unable because we're been in contracts where healthcare wasn't there yet, because these are almost all first contracts, trying to help people work through this period with no healthcare. Oftentimes the only folks who will listen to our members when they're mad is just the union. And sometimes we can't tell folks, we can't fix what's going on in an industry that's been like this for 30 years. It takes steps like the ones we're asking you guys to take today. And so our hope is before we get to a point where employers say to workers who put themselves at great risk for the past 2 years, if you don't take a shot, you're fired. We hope at least they'll have the decency to give them health care before that. But frankly, we do not believe that they will unless council imposes it, through this legislation. We really, Councilman Green, I got to say, I really appreciate your concern for our members and for folks like our members and this question, which I know, you've raised here at the airport, which we greatly appreciate, but also in lots of other contexts. And we really appreciate you thinking about people in that way.
Thank you. I just have a concern as employers are now, more people getting vaccinated and trying to open up business, and just concerned based on the history of the industry as you articulated, and that being a move that some employers take. That's why I would just raise the question of concern, especially since we're talking about healthcare, and number one healthcare issue that we've been dealing with for over a year is the pandemic, and definitely understand the concerns of hesitancy and other dynamics that your unions are helping to address with your members. But that's something that you see a quick shift in a number of people and start taking additional action as we start to act, which could have an impact on your members. So thank you for your response.
I appreciate that. I would be remiss in not saying that the Deputy Mayor, Ruchi Laser, and the administration and council people have throughout this really tried to patchwork, put together COVID testing and other things to try and help members like ours at PHL. And, and if they wouldn't have, nothing would have happened. So I do acknowledge the help of the administration and council again, and trying to help workers who are in the industry where no one in the industry seems to care what happens to them. So thank you guys very much.
Thank you, Madam Chair.
Thank you, Council Member Green. Chair recognizes sponsor, Council Member Johnson.
Thank you, Madam Chair. And I'm going to wrap up on this in terms of my comments, just thinking about like where we are right now as a society as it relates to how we are dealing with the health pandemic. And again, just reiterating how critically important making sure that workers who work at the airport have quality health care, and just thinking about the comments that Dr. Fauci mentioned the other day on, I think it was CNN Network, regarding the possibility of every year we as a society having to get a booster shot, right, as relates to COVID-19. And so that shows that even though we're relaxing different requirements, we definitely will be in a different type of new normal, because I can't remember any time since I was a kid having to get a booster shot, right, as relates to some type of virus and or illness. And so it just shows on my critically important that our new normal is making sure that we're taking care of our most vulnerable when it comes to making sure they're protected around the issue of quality health care, because it is a right. It's a matter of social justice. And as you mentioned, I'll be working with all stakeholders as we look at this issue. But ultimately, we want to make sure that those individuals who put their lives on the front line are protected, and most importantly, feel comfortable on the move our city forward at the Philadelphia International Airport, and can work comfortably knowing that they are covered from a healthcare standpoint. Thank you, Madam Chair.
Thank you, Council Member Johnson, for your comments. With that being said, I want to ask for the record if there are any additional questions or comments from members of the committee for this panel. Let me also ask, is there anyone else here to testify on the bill whose name has not yet been called? Rachel, I do think that was our final panel. Is that correct?
Yes, that is correct.
Okay. No one else here to testify on this bill whose name has not yet been called. Hearing none, I want to thank all the panels and witnesses for their participation today. We want you to know that we value your opinions. I now invite all panels and witnesses to please disconnect from the meeting before we go into our public meeting. We will now take a pause in our proceedings briefly as multiple participants leave the hearing. So to the viewing public, please just bear with us for a few moments. Okay, it does look like we are able to proceed. This concludes the public hearing of the committee on bill numbers 210325 and 210421. We will now go into a public meeting to consider the action to be taken on these bills. We are now formally and officially convening our public meeting, and we're going to call the roll. Rachel, please call the roll to take attendance. Members that are in attendance will please indicate that you are present when your name is called. Also, please say a few brief words when responding so that your image will be displayed on the screen when you speak.
Vice Chair Brian O'Neill.
President accounted for.
Councilmember Alan Dom.
Present. Thank you.
Councilmember Derek Green.
I am present. Thank you.
Councilmember Helen Gim.
Good afternoon. I'm present.
Councilmember Catherine Gilmore Richardson.
Good afternoon. I'm present.
And we are still joined by Councilman Kenyatta Johnson.
Thank you. We will now go into our public meeting. The chair recognizes Council Member O'Neill. No, or is this a motion for O'Neill, or would this be a motion for Gilmore Richardson? This is a question for our clerk.
This is for Councilmember O'Neill.
Thank you. The chair recognizes Councilmember O'Neill for a motion on the amendment to bill number 210325.
Thank you, Madam Chair. I move that the amendment to bill number 210325 be approved.
Second.
The chair notes for the record that Councilman.
Right. Councilman, I believe he needs to offer the amendment first.
Thank you, Councilmember O'Neill offered the amendment, and Councilmember, just note for us that the amendment was circulated and then move it.
Yes, on behalf of Councilman Heenan, I move the amendment to bill number 210325, which has been circulated to all members of the committee.
Second.
The chair notes for the record that Councilmember Gim seconds the motion. It has been moved and properly seconded that the amendment to bill number 210325 be approved. All those in favor of the motion will signify by saying aye.
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 Those opposed, the ayes have it, and the motion carries, and the amendment to bill number 210325 has been approved. The chair now recognizes Councilmember O'Neill for a motion on bill number 210325 as amended.
Thank you, Madam Chair. I move that bill number 210325 as amended be reported out of this committee with a favorable recommendation, and also a recommendation that the rules of council be suspended to allow first reading at our next session.
Second.
Second.
The chair notes for the record that Council Member Gim seconds the motion. It has been moved and properly seconded that bill number 210325 as amended be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
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 Those opposed, The ayes have it and the motion carries. The chair now recognizes Councilmember Gilmore Richardson for a motion on bill number 210421.
Thank you, Madam Chair. I move that bill number 210421 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council.
Second.
The chair notes for the record that Councilmember Gim seconds the motion. It has been moved and properly seconded that bill number 210421 be reported from this committee with a favorable recommendation, and further move that the rules of council be suspended to permit first reading of this bill at the next session of council. All those in favor of the motion will signify by saying aye.
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 Those opposed? The ayes have it and the motion carries. This will conclude the business before the Committee on Labor and Civil Service today. I want to thank all of our members for their attendance, and just note, I know that there are multiple events taking place, but also deemed it extremely important to thank Council Member Heenan and thank Council Member Johnson, both of them for their continuing work on the items that we just moved out of this committee today, that they will be working with all stakeholders as we move forward.